Welcome back. How are you?
Good, great. Thank you.
Awesome. I do know, I'm glad you're good. I'm good. A lot of things are good. The world of COVID is not so great right now. We are definitely in the middle of a lot of just critical conversations around COVID. And, our focus is being wellness, looking at things proactively. Really want to hear your perspective about how do we get through something such as COVID in a time that's usually so special to all of us, which is the holidays. So, what do you tell people? Like, how do we handle this?
You know, every day I feel like I'm learning a new trick on how to handle wellness and COVID and cancer. I think the important thing to realize as far as the holidays are concerned is that, COVID's not going away. Cancer doesn't care about COVID, as we've talked about. And your family is very important as far as your wellness is concerned. Support systems, your family, getting to see them. This is so important, especially in patients that have recurrent disease, where there's always that question, is it going to be my last one? And, the holidays are such a tradition and such an opportunity for us to see our families that it's hard for me to tell people not to do it. I think it has to be an individualized decision. I think that's the most important thing, is to make a decision based on what you desire. So I do, however, come up with some ideas, and I kind of talk my patients through individually what their desires are and figuring out a safe way to do it, at least to the best of our abilities. So some of the kind of summary things that we've come up with so far, or that I've come up with my patients, is obviously the best way to mitigate risk of getting COVID during this scenario is to not spend the holidays with your family. I have to say that. It's the best way, the safest way to go about doing it. However, if you're going to do it, because like we talked about, it's important for wellness to be around your family, to see your family, what are some ways that you can do it safely? So the next best is Zoom, which we're doing right now. Zoom is a great way to spend the holidays with your family. I've spent the holidays with my family personally over the years via Zoom and FaceTime before Zoom existed, as a resident, not being able to have holidays with my family and having to work or living out of state. So it can be done. It's a little different, but you kind of get used to it. But if you are going to get together, a couple little tricks to think about. One is keep the bubble small. Like, instead of having the big 50-person family gathering, break it down into a smaller family gathering. The less people that are there, the less risk you're going to have. Because what you have to realize is each one of those people, while you're sitting there thinking, well, I only saw 7 people during the holidays, you have to realize that those 7 people saw 7 other people the week before, or 10 other people. And then it becomes exponentially more risk of exposure in that scenario. The next thing is setting expectations. Making sure your family knows that you have cancer and you're wanting to limit your risk can be very helpful. Letting your family know that you're going to wear a mask, because I'm going to recommend it. Staying 6 feet away from each other. Letting the grandkids know not to hug Gra-Gra or Grandma. Sorry, Gra-Gra is what I call my grandma. So, Gigi, Nana, Grandma. Like, making sure that you kind of set expectations for everyone in the family. Hand sanitizer is critical. We talk a lot about wearing masks, and that's very important to reduce the risk of spread, but hand sanitizing is actually equally as important. And I feel like it's not talked about quite as much. Washing your hands, hand sanitizer, having it on you. I prefer pumps. I'll admit to that, because it's easy just to pump really quickly when you've got one in your pocket versus having to pull out the bottle, open the top, squeeze it out. Like, it's a little bit more challenging. I like a good pump hand sanitizer that's lying around. The other one that I've talked to a couple of my patients about is, as much as you would love to have your banquet and having the big potluck Thanksgiving, is having one person prepare all the food, wearing a mask, wearing gloves, sanitizing their hands, making each plate individually, and handing it to everyone. Because that way you're not all touching the same dishes over and over again, the utensils, the spoons, all of those types of things. And I think that can really lower the risk that you're spreading the disease at your family event. And then making sure you're in a space where you have a lot of room for everyone that's there. Obviously, if you're trying to fit 10 people into a tiny little living room, you're not going to be far enough apart. but doing it at one of the houses or in a dining room or a big basement, or even renting out a facility. I know one of my families is renting out a church room so that they can do their family event in a church room so they can spread out a little bit more. So these are just some things that you can do to kind of help.
That's really helpful. You mentioned something that also makes me think about the COVID and cancer conversation together. COVID does not care about cancer, and cancer doesn't stop because it's COVID. So what do you tell people when they're just nervous about, coming to the ER, following up with their physician? How do we handle that? What's the best way forward?
Well, I think the important thing to realize is that most of your doctor's offices, particularly your oncology offices, are taking huge steps in order to reduce the risk of exposure within the office. They do that for lots of reasons. One, our chemotherapy suites have to be very, very safe for those patients in particular. So, we're taking steps to not let loved ones come in, which I know is hard, but it really helps reduce that risk of transmission. Also, to keep the healthcare providers still working. It's not that we don't want to get COVID. I mean, yes, I don't, but it's really more because if I can't work, who's going to take care of my patients? And so that's really a big part of it as well, is to keep the workforce working. As far as I know, there aren't a significant number of people getting COVID from coming to the doctor. The doctor's offices are being safe. We're screening patients, we're wearing appropriate PPE, we're doing hand sanitizing, we're doing all of those steps that we need to do. So the first thing I tell patients is don't be afraid to come see me. Like, I need you to come see me, because if you don't, then there's always the chance that something is very terribly wrong, or we're going to delay a diagnosis that we could have prevented earlier or intervened on earlier. So I think that's one of the big things, is don't be afraid to go to your doctor. Did that answer your question?
Absolutely. I think it's really important. There's a lot of delayed screenings right now, just delayed regular care. We talked a little bit on and off through our conversations about telehealth is great, but there's a reason that people want to put their eyeballs on you and just sort of, feel different areas that they're trained to feel. So it's really important for patients to remember that we don't want to delay things, because cancer doesn't care if COVID is going on. So it's important to follow up with your physicians. And if you have questions, call the office, ask about their protocols and screening protocols, and get familiar and comfortable. And don't delay, because you have to take care of you, which is one of the number one things about wellness. Dr. Anything to add to
that?
Yeah.
When it comes to telehealth, the things I tell a lot of people is, we do telehealth. If there's a problem and you don't feel like it got fixed by your telehealth visit, call again. This is where you get to be your own advocate. Come in, say, nope, I don't want to telehealth. Something's wrong. I want to be seen. I'm worried. And so that's the key term I always say is, I'm concerned. If a patient calls and says, I'm concerned, that triggers me something that I need to see them, that a telehealth is not enough. I need to see them and figure out what's going on.
That's awesome. Thank you. That's great advice. Happy holidays to you.
You too.